There are many different ways of intermittent fasting. It partially abstaining from eating for a set amount of time before eating regularly again. Many studies suggest intermittent fasting offers benefit such as fat loss, better health, and increased longevity. Each person's experience of intermittent fasting is individual and different styles will suit different people. In this video, we discuss most popular types of intermittent fasting. There are various methods of intermittent fasting and people will prefer different styles. 1. Fast for 12 hours a day. A person needs to decide on and adhere to a 12-hour fasting window every day. Person could choose to fast between 7 p.m. and 7 a.m. for 12 hours. Fasting for 10 to 16 hours can cause the body to turn its fat stores into energy. It releases ketones into the bloodstream. This should encourage weight loss. 2. Fasting 16-8 diet method. Fasting for 16 hours a day, leaving an eating window of 8 hours is called the 16-8 method or the lean gains diet. On this fast, people usually finish their evening meal by 8 p.m. and then skip breakfast the next day, not eating again until noon. 8 diet hours protected them from obesity, inflammation, diabetes, and liver diseases. 3. Eat healthy diet. 5 to fasting. During the 2 fasting days, men generally consume 600 calories and women 500 calories. Typically, people separate their fasting days in the week. They may fast on a Monday and Thursday. Eat normally on the other days. There should be at least one non-fasting day between fasting days. The study also found that this diet reduced insulin levels and improved insulin sensitivity among participants. Over the course of one menstrual cycle, the women lost 4.8% of their body weight and 8% of their total body fat. 4. Alternate day fasting. Alternate day fasting means a complete avoidance of solid foods on fasting days, while other people allow up to 500 calories. On feeding days, people often choose to eat as much as they want. Few studies reported that alternate day fasting is effective for weight loss and heart health in both healthy and overweight adults. Another study found that 32 participants lost an average of 5.2 kilograms or just over 11 pounds over a 12-week period. 5. A weekly 24-hour fast. On a 24-hour diet, person can have teas and calorie-free drinks, fasting completely for 1 or 2 days a week, known as a heat stop heat diet. It involves eating no food for 24 hours at a time. Many people fast from breakfast to breakfast or lunch to lunch. People on this diet plan can have water, tea, or other calorie-free drinks during the fasting period. People should return to normal eating patterns on the non-fasting days. Eating in this manner reduces a person's total calories intake but does not limit the specific foods that the individual consumes. A 24-hour fast can be challenging and it may cause fatigue, headaches, or irritability. People may benefit from trying a 12-hour or 16-hour fast before transitioning to the 24-hour fast. 6. Meal skipping. The flexible approach to intermittent fasting may be a good for a beginners. It involves occasionally skipping meals. People can decide which meals to skip according to their level of hunger or time restraints. It is important to eat healthy full foods at each meal. People using this style of intermittent fasting will eat when they are hungry and skip meals when they are not. 7. The warrior diet. The warrior diet is a relatively extreme form of intermittent fasting. The warrior diet involves eating very little, usually just few servings of raw fruits and vegetables during a 20-hour fasting window. Then eating one large meal at a night. The eating window is usually only around 4 hours. This form of fasting may be best for a people who have tried other forms of intermittent fasting already. Humans are natural nocturnal eaters, and that eating at night allows the body to gain nutrients in line with its circadian rhythms. During the 4-hour eating phase, people should make sure that they consume plenty of vegetables, proteins, and healthful fats.